Hi everyone, I'm Dr. Alex. I'm an ENT doctor with Asian Healthcare Specialist, and today I'll be talking about allergic rhinitis. Allergic rhinitis, also commonly known as sensitive nose, is a type of nasal disorder. So in such a condition, the nose is overly sensitive to common things in our environment, for example, dust mites or pet dander. And in allergic rhinitis, some of the common symptoms include nasal congestion, runny nose. There can also be itchy eyes, tearing, as well as a scratchy throat. In the diagnosis of allergic rhinitis, first of all, we'll be taking a history from our patients. We want to know what symptoms the patients have, the severity of the symptoms, as well as what are the triggers that bring forth the nasal symptoms. And after which, we will also proceed with a physical examination. Essentially, we'll be doing a nasal endoscopy to see, to look into the nose and see where the obstruction is and whether there are any complications from the allergic rhinitis as well. And lastly, in some cases, especially those with severe symptoms, we would recommend doing an allergy test. This can be in the form of a skin prick test where we will be placing allergens on one's skin and see whether it reacts to it. Alternatively, we can also do a blood test to assess one's immune system and see which allergens the patient might be allergic to. Right, so the treatment for allergic rhinitis is tailored to one's symptoms as well as lifestyle. So in general, it can be summarized into 3 steps. First would be to avoid, second to relieve, and lastly to prevent. In avoidance, we would recommend allergen avoidance. So if we know what triggers the patient's symptoms, we would recommend allergen avoidance. For example, if one is allergic to dust mites, then we would recommend washing our bed sheets and bed linen once every 2 weeks, and also having dust mite covers to reduce the exposure to dust mites. For relieving of nasal symptoms, we would recommend medications. This can be in the form of oral or topical medications, and commonly used medications include antihistamines as well as intranasal steroids. And lastly, for patients who have severe symptoms, we would recommend immunotherapy. Essentially, for this treatment, we are retraining our immune system to stop being so overly sensitive and reacting to common things around our environment. Right, so there are a few ways we can go about this. One would be to stay hydrated throughout the day. So by staying hydrated, it keeps our nasal cavity and sinuses moist. Second, for example, in flu season, we should maintain a good hand hygiene and so that we can be at lower risk of contracting a flu or a cold. If one has nasal allergies, we should treat this nasal allergy well, which will decrease the nasal symptoms. And lastly, having a good night's rest and having a balanced, healthy diet would help in strengthening our immune system and help fight any nasal infections that we could contract.